Today I'm going to be doing my IM injection validation video. First we're just going to scan the room, show that there's nothing on the walls or anything, and also just show my MAR that it is just the printed information. So today here we have Joanne Peterson, date of birth 12/10/47. She has no known allergies. She has a high fall risk, full code. She was admitted because she recently had a lot of dehydration and falls, and her son found her at home. Her past medical history is hypertension and asthma. She's currently on 20 milligrams PO daily of furosemide and an albuterol inhaler, 2 puffs daily as needed. She does live alone, but she has 2 children, and her son lives next door, and she's also retired right now. Her vitals look good, everything's stable. SpO2 is 98% on room air, good temperature, heart rate of 76. She's alert and oriented, and it says she's resting in bed. Clear lung sounds and everything. She is ambulating with assistance, so she's on bed rest at the moment. She has some soreness from her fall, and she has a few standing orders on the MAR. I'm just going to look at it. Looks like she has Fluzone 0.5 milligrams intramuscular injection due now. So I'm just going to go in there and ask her some questions before I prepare the medication. So I'm going to enter Joanne's room. Knock, knock. Hi, I'm Sam. I'm going to be your nursing student today. I just had a few questions for you. Can I first get you to verify your name and date of birth?
Joanne Peterson.
Look at your armband. Joanne Peterson. Awesome. And can I get your birthday as well?
Yes, 12/10/47.
Awesome. Okay. So, I guess I actually don't need these at the moment. So I just saw you had a standing order for a flu vaccine. I just wanted to ask you some questions. If you've ever had the flu vaccine before,
I have.
and have you ever had any adverse, allergic reactions to it when you've had it?
No, I have not.
Have you ever had Guillain-Barré syndrome before from a flu vaccine?
What is that?
It's a severe reaction you can get to it, but if you don't know what it is, you probably have not had it before.
Okay.
And I also just wanted to ask, have you ever, do you usually feel dizzy or anything, lightheaded after you get vaccinations?
Nope.
Okay, and then do you have a preference? You can get the flu vaccine either in your deltoid muscle, your ventrogluteus, so which is on your butt, or you can get it on the outside of your thigh, your anterior, or ventrolaris lateralis. Do you have a preference on those 3?
I'd like it in my left arm.
Okay, so you'd like in your left arm. I do also recommend, if that's your dominant arm, that does help work the medication in, and it can prevent some soreness with that. It is going to have some soreness, but it can just help prevent that. And I also wanted to let you know that the flu vaccine, it's not going to cause you to get sick. It's injecting inactive viruses, but it can lead to some fatigue. You might feel a little under the weather, groggy after getting it. Do you have any questions about that?
Nope.
Okay, awesome. So I'm just going to make sure that your bed's in a good position. Your bed rails are up. You have your collate, and I'm going to go prepare that medication.
Okay, thank you.
Okay.
She's used to think it's not bad, and I did it at the bedside. I said 0.5.
Okay, so I'm back in the med room now, and I'm going to start my Fluzone. I have my MAR here to compare against. We're doing Fluzone 0.5 dose for that. The medication was Fluzone, route intramuscular injection. It's due now. Reasoning, she is 65 of age, so she has an increased risk for influenza, so it's good to just have that extra prevention there. And also just because it's good to have yearly to prevent the flu or decrease the severity of it if she does contract it. And so yeah, and then we'll document after we administer it. So first I'm just going to look at my vial. Influenza, 5 milliliter multi-dose vial, which matches with that. Fluzone, this is meant to be given IM now, and then it does say shake well, so we're just going to shake that first. So we did our first med check, and now as I'm drawing it up, I'm just going to grab my supplies, and I'm going to draw it up. Yeah.
She is currently on furosemide.
Yeah, okay. I'm going to disinfect the top, and while I'm doing this, I'm also just going to check again. Fluzone, we need 0.5 milliliters. Yep. And since this is a multi-dose vial, it's not sterile, so we're just going to make sure we're sterilizing the top of that. And we're going to be using a 22 gauge 1.5 inch needle because this is IM, and she has a good, like, not too much body fat on her, so we don't need any longer needle. 1.5 inch should work just fine for her. And we're going to draw up with a blunt end tip with a 3 milliliter syringe. So I'm just going to open these, keeping them sterile, just opening the tip so I can connect them. Nothing's touching, still sterile.
And do you have a preference on your arm, or is the left one okay? Left arm is good. Okay. And do you have any
I'm going to
questions?
connect those. And then since we are drawing up, again, 0.5 milliliters, I'm going to drop 0.5 milliliters of air into the syringe before and then I'm going to inject that into the vial. So I'm going to draw up 0.5 milliliters.
0.5 milliliters through IM.
Still sterile, it's already been. And then make sure I'm not touching any of that. I'm injecting the air. And then now I'm just going to draw up.
Looks okay, it's not expired. It is clear.
I'm going to draw a little past 0.5 just so I can get some of those air bubbles out to prevent air embolisms.
Gather all my supplies. So I have my syringe, I have my blunt needle, and I have my
I'm just going to flick out some of those.
needle that is 1.5 inches in length, and we just want to make sure that it's long like that so it gets all the way into the muscle and passes through the other layers. Since it is an IM injection, so then I'm just going to do my second med check.
Okay. So now that I have no air bubbles, I'm at 0.5. I'm going to one hand cap that back on the blunt needle, just showing again I have 0.5.
Prevention, and there's going to be
0.5, no air bubbles, and I'm going to switch to a sterile 22 1.5 inch needle that will be used for her injection. Again, nothing touching that, keeping that completely sterile, taking off the blunt end, screwing that in, keeping that there. This is going to be disposed of in the sharps container, and then I'm going to label this for her, doing my second med check now that I have it all dialed up. I have Joanne Peterson, who it's for. It's IM, which we're giving like that. 0.5 milliliter Fluzone medication. It's a now medication. Indication just flu prevention. I'm just going to stick that onto my vaccine so I can do my third med check in the patient's room. Bring my vial with me. The MAR here. So okay, knock knock. Hi Joanne, I'm just back. And nursing student Sam back here to give you your flu vaccination, do some hand hygiene. Can I have you confirm your date of birth and name again?
Yes. Joanne Peterson, 12/10/47.
Okay, thank you. Put some gloves on. Okay, so I have your flu vaccine drawn up. Are you feeling anxious about this at all? Or are you feeling good about getting your vaccination?
I'm a little anxious. Is it gonna hurt a lot?
It might burn or sting a little bit. That's normal,
Okay.
but nothing too bad. You got this. You're gonna be a rock star at it.
Okay.
Okay, so first, I want to confirm you wanted your left deltoid muscle, correct?
Yes.
Okay, so I'm just going to go 3 finger lengths down from the chromium process, and then I'm just going to sanitize with an alcohol swab. And I'm also going to do my third med check against the vial on the MAR right before administering. Again, I have Joanne Peterson, Fluzone, 0.5 milliliters intramuscular, due now for flu prevention.
So at this point, I will go ahead.
Remove that tape. And then now I'm going to remove my needle cap.
Can I get a name and date of birth one more time, please?
Make sure nothing touches it. And then I'm going to make sure I do a Z-track, so I pull the skin, and then I'm just going to go at a 90-degree angle, because this is intramuscular. And we're just going to push at a nice little rate, not too fast, not too slow.
you from getting the flu.
And pull it out.
Um,
And if there is any bleeding, I would put a band-aid. I'm going to recap with the safety device on the needle, place that in the sharps, and then I'm going to perform hand hygiene. Are you still doing okay, Joanne?
Yes, I'm doing okay.
Awesome. Okay, so I just want to let you know that I will be back in about 15 minutes to check on you, just to make sure you're not having any adverse reaction to the injection. I don't anticipate any, but just going to check on you. So now I'm going to make sure bed rails are good, call light's still good, bed's in a low position. I'm now going to go back out and I'm going to document that I gave her 0.5 milliliters of Fluzone intramuscularly into her left deltoid muscle. Okay, it's been about 15 minutes. I'm now going to knock. Hi, Joanne. I'm Samantha here, your nursing student, back to check on you. How you feeling?
I'm feeling pretty good.
Not lightheaded, dizzy, feverish at all?
Nope.
Awesome. Okay, so do you need anything else?
Nope. It should be okay.
Okay, great. I think that concludes IM injection validation.